Okay, this model of the kidney will take a look at regions, structures, and then some up-close anatomy. The kidney has two regions or zones. The outer one, the first here, is called the cortex, which means outer zone. It's a lighter red there, almost pink, that part I'm touching. And then the inner part is a medulla, medulla meaning middle, so this is toward the middle. It's everything else that's in there and all its parts. Now to look at some of the parts. Here are the microscopic nephron. There are about 1,000,000 of these per kidney. That's what's in white there. I'll detail it later. Those nephrons are packed into pyramid-shaped structures there that I've circled in yellow. Those areas are pyramids. And then at the tip of the pyramid is the renal papilla. They will release the filtrate, now called urine, into the center of the kidney. It'll be released into those hollow spots. The hollow tubes are called the minor calyx, meaning the first of the calyx. And then they will collect into the major calyx, or plural major calyces. And then from there, all that urine that's collected will go down the hilum and into the ureter, and then down below outside the model into the urinary bladder. On some other structures, blood flow. Here's a renal artery coming in and it branches. Some of them are shown here, and then those branch into the interlobar arteries that are in red, and the interlobar vein is in blue. A close-up of that. Here taking a look at those segmental arteries that come off of the renal artery, the segmental, and then the arrows show the direction of blood flow, of course the arteries. And then they go into the interlobar artery again. So the segmentals there carry blood into the interlobar, then the interlobars branch into the arcuate artery, meaning curved, and they're red. And then those arcuate arteries will branch into the interlobular arteries, right there at the pointer, many of them. And then branching off of the interlobular arteries will be these renal corpuscles that they've somewhat detailed there, those bulges or pimple-like looking structures. Then for the nephron, that line there is the proximal convoluted tubule, then the loop of Henle, which is detailed more in your textbooks, and then the next tubule will be the distal convoluted tubule, and the filtrate, when it's produced, will then collect into those collecting ducts. This one is tried to make obvious, but the other fine lines there, right there, make up the renal pyramids, and they together will collect all this filtrate being produced from the blood to be carried out, and the tips of the pyramids are referred to as the renal papilla, and that's where the urine will flow into that hollow minor calyx, or plural calyces, and then from there the urine goes down to the bottom left.